Thank you very much. It's a great pleasure being here today. Since we have such a large audience, please feel free to ask questions as we go along. Today my topic is on common foot and ankle conditions, and I'll just do a quick overview. Some facts to know is that the average person walks a distance of twice around the earth in their entire lifetime. The feet contain 1/4 of all the bones in the human body, meaning that each foot contains approximately 26 bones. Many of the experts say that 10,000 steps each and every day is what you needed for a healthy lifestyle. So they say get your pedometer, walk around, go to the mall, go to the store, and see if you're meeting your 10,000 steps. I'm a podiatrist. I specialize in foot and ankle surgery and also aspects of treating the foot and ankle. Some of the things I treat include skin and nail problems, tendon, ligament injury, muscle, nerve condition, bone and joint conditions, and systemic illnesses such as diabetes, PVD, and all types of arthritis. Of the 26 bones, they are broken down into forefoot, which include the toes as we know them, the metatarsal, and then the hind foot, which include the cuboid, the calcaneus, and the talus bone, which connects to the ankle. Corns and calluses. The difference between a corn and a callus is that a callus is generally an area of friction that exists usually against the surface of a shoe. You have shearing forces, or you have friction that produces thickened skin, which we call a callus. Versus a corn usually exists on a bone-producing surface, and it produces what we call a corn, usually adjacent to a hammer toe or other phalanges. The typical non-surgical treatment of calluses includes urea cream. Urea cream is available in many forms. We prescribe it as a cream that you apply to the area once or twice a day, and that typically takes the skin down to an area that we can then treat it at home. Onychomycosis, a big long word for an ingrown nail. An ingrown nail consists of the nails that grows into the corners. Do we have a pointer?
No.
Okay. A normal nail, of course, comes out to the skin edge and skin fold. As you see, this nail forms a musical C shape and digs into the corner of the nail, produces redness, pain, which could lead to infection. And of course, in diabetics, this could be a real true emergency. As we said, an ingrown toenail can lead to infection. This is an area of infection. Well, we have an ingrown nail, which produces erythema, or redness on the side of the nail, pus formation, and that needs to be surgically taken care of. This is an example of a post-surgical nail where that same ingrown nail has been removed, and we see that the medial and the lateral borders of the nail, the inside and the outside of the nail, has been cleaned and the infection has been taken care of. Another painful area is what we call a subungual exostosis. Sub means underneath, ungual is the nail. Exostosis is a bone that grows basically on top of another bone. So what we have is a bone that's growing underneath the nail, subungual exostosis. Very, very painful. Usually these are surgically removed to alleviate the pain. Another condition is called Tinea Pedis, or what we call athlete's feet. Athlete's feet take many forms. We have dry form, we have wet form. Athlete's feet is cured with a topical antifungal. Most people use a store brand antifungal, and in 2 to 3 weeks present with the same problem again. Athlete's foot is an infection. It is a fungal infection, and it is contagious. Ringworm. Ringworm is not a worm. Ringworm is actually a condition that exists on the skin. It's usually well circumscribed, and it's also treated with a topical antifungal with a corticosteroid. Warts. Verrucas plantaris. Warts, HPV-1, or what we call herpes type 1. Warts exist on the skin. They are contagious. HPV-1 can be transferred from person to person. They love environments that are warm and wet, and they strive in that environment, and they multiply. Treatment is usually to take care of the mother lesion, or the first lesion that exists, and the other lesion should die away. Mosaic Verruca is what we call the multiple warts, where the mother lesion exists and then you have the multiple lesion that exists alongside those lesions. Another misconception is a mucoid cyst, usually diagnosed as a tumor. It's a tumor on top of the toe, and it is a tumor because it does exist, but it's a cyst that consists of mucus. It usually exists at a joint, and drainage by surgical means is the #1 treatment. Again, onychomycosis, a toenail fungus. This is a white superficial toenail fungus. This is the most common type that we see. It's treated with either topical treatment, oral medication, or surgical excision of the nail. And it should be noted that surgical excision of a toenail is not a cure for onychomycosis. You need treatment for the fungus. One of the most common things seen in my office is plantar fasciitis, or heel spur syndrome. Heel spur syndrome exists on the bottom of the foot at the heel, where the fascia, which is the tendon on the bottom of the foot, connects the toes to the heel bone, or what we commonly call the arch. Plantar fascia hurts very bad in the morning, rest pain. So when you first get out of bed, you step down, you have that pain at the bottom of your heel. The heel spur, which is different from the previous slide of plantar fasciitis, the heel spur exists as actual bone that exists on the bottom of the heel, which is the calcaneus bone. Along this bone is where the plantar fascia attaches, and it attaches to that area which is we call the heel bone. Common treatments includes orthotics, or heel inserts, to take the pressure off of that heel bone, the windlass mechanism, where that tendon is now supported by the arch, and you don't get that stretch, thus causing pain in the morning. Pump bump. You see, a lot of things have names. The pump bump was named because it's on the back of the heel. A lot of women experience pain on the back of the heel. It comes from wearing pumps. You get a bump where the tendon attaches to the bone, hence the pump bump, or Haglund's deformity. Haglund's deformity, the pump bump, exists as this bone that sits on retrograde or behind the calcaneus, as opposed to the other one we saw, which was underneath the calcaneus. Tendon. The Achilles tendon is the strongest tendon in the entire body. Tendon is a strong fibrous structure that attaches muscle to bone. In order to work properly, it must guide to move the joints of the body. The Achilles tendon is used for push-off, take-off. Hence, it's also injured when you start from a standing position. A lot of people injure this tendon playing tennis or basketball. This is an MRI. An MRI shows the Achilles tendon as it comes from the heel bone. This area is the white area, and this is Achilles tendon again. With an MRI, it shows area of damage localized by that white area, which shows fluid or where there's disruption of the tendon. The bunion. The bunion is probably the second greatest thing I see in the office. A bunion is either structural or positional. Usually hereditary. It has a lot of etiological factors, and a flat foot being one of them. Hallux valgus exists when you have a separation of the first metatarsal to the second metatarsal, and it leads to a deviation of that first metatarsal joint. On the left side, you see a pre-op x-ray of a bunion where the bump exists on the side, and on the right, you see a post-op where we've taken off that bump, we've realigned the toe, and then we fixated it with a screw in place. That screw stays in place. It does not necessarily have to come out, and it does render some structural stability to the bone in early post-op, I'm sorry. This is just an example of a post-op bunion as we realign the toe. The second thing is a hammer toe. A hammer toe exists because it looks like a hammer, with this being the base of the hammer, this being the head, and this is where you drive the nail in. Hence, someone say, hey, it looks like a hammer, and they call it a hammer toe. A hammer toe exists in shoes, usually at the PIP joint, but it can also exist at the other joints exists as a irritation at the PIP joint as it rubs against the shoe. These are claw toes. As I said, they can exist at multiple joints. So when you have a buckling at the PIP joint and at the DIP joint, then you get what is called a claw toe, as it looks like a claw. Flat feet. Flat feet is very, very predominant, especially in the African American community. Flat feet exist usually as a genetic variant, can also be from neurological or post-trauma. A pronated foot or flat foot exists, and it can lead to problems over a long period of time. Arthritis. Arthritis comes in many forms. Traumatic arthritis, osteoarthritis, rheumatoid arthritis. Arthritis is not a cure. There's no cure for arthritis as of yet. There are various treatment regimes for arthritis. Hallux Rigidus is a form of arthritis, but it's hallux, which is the big toe. Rigidus means that the big toe doesn't move. So what happens here is like any other joint that needs replacing, a hip joint, a knee joint, we replace the big toe joint. On the right side, as you see, that is what a hemi implant would look like. So you can imagine when someone has their hip replaced or the knee replaced, well, this is what it looks like to have your toe replaced. Morton's neuroma. Neuroma is the nerves. Nerves exist in between the toes. So we went over the digits, we went over the hammer toes, but in between the toes, each toe has its own corresponding nerve. Sometimes that nerve can be irritated. The nerve swells and it causes pain to each adjacent toe. That is called a neuroma. Treatments for neuroma exist of changing shoes, taking the pressure off the nerve. Sometimes we inject the nerve, and on the right side, of course, there's also surgical intervention. And then there's diabetic neuropathy. Diabetic neuropathy exists as a musculovascular disease resulting from diabetes. As we have decreased circulation, we have increased irritation from shoe gear or outside sources, which leads to a breakdown of the skin. Foreign body is something else that you can obtain in the foot. Foreign body usually comes from, of course, you stepping on an object. With diabetic neuropathy, you can step on that needle because, if I said you have a decrease of nerve sensation, that needle can be in your foot and you never know it. That can lead to infection, which can also lead to amputation, et cetera, et cetera. Metatarsal stress fractures. A broken bone exists when the cortical edges of the bone is disrupted. Sometimes you can get an irritation where you don't see a cortical break in the bone. This is called a metatarsal stress fracture. From repeated stress over an area, you weaken the cortical edges of the bone, you get a breakdown of that bone. Stress fractures may not be seen on x-ray for up to 2 to 3 weeks after the initial injury. This is a slide just showing that the bone itself looks normal, but glancing down the bone, this is what a stress fracture would look like. It is very, very hard to diagnose, and it's oftentimes missed. Ankle sprain. Ankle sprain exists when you have an acute inversion, sometimes an eversion of the ankle mortise. There are 3 ligaments laterally and the deltoid complex medially. Grade 1, 2, and 3 ankle sprains exist when you either disrupt the first, the second, or all 3 ligaments. This is a stress x-ray showing how we test the validity of the ligaments, where normally an ankle exists where the bones are straight ahead, but sometimes you can twist that ankle mortise of the foot outside of the ankle, showing that those ligaments have been ripped apart. The treatment for an ankle fracture consists of cast immobilization to allow that ankle to heal over a course of 6 to 8 weeks, or by surgical intervention where we place a screw and plate to realign the ankle bone. And that's my talk.